Hi ladies, in today's video we're going to be talking all about vaginal odor. What's normal, what's not so normal, and what to do about it if you are experiencing abnormal vaginal odor. If you're new here, my name is Dr. Shadi Tabaei. I'm a naturopathic doctor and a women's health and hormones expert. And every week, Lord willing, I do make videos on different topics on women's health. So if you wanted to go ahead and subscribe and join this growing community, I would love to have you. As a woman, I know what it's like to wonder if my vaginal odor is normal. I feel like this is a big insecurity on a lot of us because society as a whole makes us think that our vaginas are supposed to smell like roses and they're supposed to taste like pineapples and there's never supposed to be an odor to them, and that's just not realistic. So I want to talk about what is considered normal vaginal odor and when to know when it's abnormal and what to do about it. First thing first, it's totally normal for your vagina to have an odor. If you think about it, your vagina produces discharge and it releases blood. And anything that produces discharge and releases blood is naturally going to have some sort of smell to it. Now, this smell will vary from person to person in terms of its intensity and how it specifically smells, but it should be a pretty light odor that is not recognizable by other people. It also should come with some normal amounts of discharge, and discharge is usually white or clear in color and can range from being thinner to more thick. And this can vary throughout our cycle as well. Usually after we end our periods, the vaginal discharge is a little bit less, and so is the smell. And during ovulation, the discharge is a little bit more, and so is the smell. And then again, right before our period, the discharge becomes a little bit less, and so does the smell. So it kind of fluctuates throughout the cycle. Now, what is considered abnormal vaginal odor? Well, abnormal vaginal odor is basically any odor that is abnormal for you that you haven't smelled before. Usually this odor is pretty foul in nature and can oftentimes be fishy. Sometimes it can come with a change in the color of our discharge. So the discharge can go from clear or white, which is normal, to more green or yellow or even gray color. And so if you're seeing an abnormally foul smell with changes in the color of your discharge, then it's something that you want to get checked out. This is considered abnormal odor. Now, what do you do if you are experiencing this? The first thing that you want to do is rule out an infection. So it's important to go to your doctor and get a vaginal swab done to rule out infections like bacterial vaginosis or yeast infections or chlamydia or gonorrhea or trichomonias. These infections can cause changes in the odor of our vagina as well as the discharge. So it's definitely something you want to rule out. If it is positive for infection, then you want to use the appropriate treatment. So you may need antibiotics or antifungal medications to treat that specific infection. And once the infection goes away, usually the discharge and the abnormal smell also goes away. Now you might be saying, Dr. Shadi, I did all of that. I went to the doctor, I got a swab done, and everything was negative, but I'm still having this odor. What do I do? Well, I got you. Let's talk about some things that we can start to do to improve our vaginal smell. First of all, I want to talk to you about how clothing influences our vaginal smell. When we wear clothing that is very tight fitting or it's not cotton based, what happens is that moisture starts to build up in the area, and this can increase the vaginal smell. So what I would suggest instead to try to wear looser clothing as well as cotton based underwear. And that way there's more breathability for the vagina and the smell doesn't build up. A lot of women will also wear panty liners to avoid the discharge and the smell from getting on their underwear. But I would actually recommend not doing that because it can actually build up moisture and the smell. Whereas if you're using the underwear, it's more breathable and the smell is less. What I would also recommend is to try to change your underwear multiple times throughout the day, maybe 2 or 3 times, whenever you see a buildup of discharge or smell. And that way you're starting brand new with a fresh new underwear and it's more breathable and less smelly. This does involve doing more laundry, but hey, there's a give and take to everything, right? Now, the next thing I would suggest is to improve the way that you are washing the vulva and the vagina. First of all, your vagina does not need to be washed. You don't need to squirt anything up your vagina to make it clean. Your vagina is a self-cleaning organ, and so it doesn't need your help. Please do not put anything in your vagina to help wash it because this can disturb the pH of the vagina and it can actually make things worse. And then the vulva, which is the outside area of the vagina, the tissue outside, this area doesn't need to be cleaned with anything like washers or wipes because oftentimes these things have chemicals and fragrances and synthetic material in them that can actually irritate the area and make the situation worse. So instead, what I would suggest is to use your clean hands when you're taking a shower and use warm water and just open the labial folds and just clean it with your hands. Water is the right pH for the vulva and the vaginal area, and so it's the perfect cleanser. So you just want to spread it out, clean it, make sure you're getting all the gunk out of there, and then you're good to go. You don't need to use anything else. But if you do want to use something, I would suggest using products that are mostly water-based to avoid the change in pH that comes with using anything synthetic. Okay, well, now you might be saying, Dr. Shadi, I am doing that. I'm wearing a cotton underwear, I'm wearing loose clothing, I'm only washing it with water, but I still have a smell. What else can I do? Well, in these cases, there are a few more things that you can do, and there are some things that I usually recommend for my patients. The first thing being probiotics. I usually recommend probiotics that are rich in L-rhamnose. This is the specific strain of probiotics that are found in your vaginal microbiome. So this is the form of probiotics that you want to be using, that specific strain. If you're using just a multi-spectrum probiotic, it might not have as much of an impact because you're not specifically using the strain for the vaginal area. So oftentimes I'll use a vaginal probiotic as well as an oral probiotic that is specific for the urogenital tract. And this can improve the microbiome down there so that it can help to improve discharge and smell. Second thing that I often use is vaginal vitamin C. Now, don't go in your cupboard and shove your vitamin C up your vagina, please. You need to use specific vitamin C that's made for the vagina. So these are vaginal suppositories of vitamin C. What vitamin C does is that it helps to acidify the vaginal environment. The vaginal environment is naturally acidic, and this helps it to fight against infection and keep things at bay. But sometimes if the pH changes, this can also change the smell and the discharge. So vitamin C helps to restore a natural acidic pH, and it can often help with smell and abnormal discharge. It usually comes in a little ovule that you put in your vagina, and it comes in about 7 to 10 day treatment. And I usually recommend doing that for 7 to 10 days and then stopping it, and then whenever you're feeling the symptoms again, maybe starting it again. But again, talk with your naturopath or your medical doctor about this, because sometimes it can be irritating and it might not be the right treatment for you. You're probably also waiting for me to talk about boric acid. I do love boric acid in certain situations. I like using it when there's recurrent bacterial vaginosis, or when we're trying to prevent bacterial vaginosis, or we're trying to treat yeast infections that have been resistant to treatment. In these cases, I do use boric acid, but because boric acid kind of kills off everything in the vaginal microbiome, I don't like using it too much because we don't want to kill the good bacteria at the same time. We only want to kill the problem areas, the problem bacteria. But boric acid kind of clears everything out, so it's not something we want to be using regularly for smell. So in these cases, I wouldn't suggest it for smell, but I know a lot of women do find it helpful for it. But you definitely don't want to be overusing it. There are also dietary patterns that are associated with improved vaginal health. Women who eat more of a Mediterranean style diet with lots of fruits, lots of vegetables, lots of healthy fats, fish and lean proteins like chicken and egg tend to have improved vaginal health and improved risk of infection. And so this is the type of diet that you want to try to adopt when you are having, vaginal issues. Now, there's no specific research showing that this specific food will help with the smell of your vagina, but there are dietary patterns that help to improve vaginal health in general. And that dietary pattern is mostly that Mediterranean style diet. Well, there you have it. There are some things that you can start to do to help improve your vaginal smell. Let me know in the comments below if you have any questions. And if this video did help you, please press that like button so that it can reach more women just like you. Please check out the other videos on my channel, and I will see you in the next video.